Hi, therapy issuers. Thank you for joining in on our conversation between licensed mental health professionals. This is not meant to substitute a relationship with a licensed mental health professional. Should you become triggered or begin experiencing a mental health crisis, please go to your nearest mental health hospital, emergency room, or dial 911 or 988. And always remember, we are human first and therapist second. Follow us on Instagram, Twitter, Facebook, TikTok, and subscribe to our YouTube channel using the handle @Crave Counseling. This is Therapy-ish. All right, welcome back to another episode of Therapy-ish. And today I have Aliyah White, who is an LPC-Associate here at Crave Counseling. And I'm going to have her introduce herself and tell us a little bit about herself, the population she serves, and social media handles if you have any for your therapy space, not your personal.
So my name is Aliyah White. I work here at Crave as a therapist. I was born and raised in Austin, Texas, and I mainly work with clients in the Round Rock or Central Austin area. No professional handles at the moment.
Okay. All right. That works. All right. So what does prioritizing mental health actually mean and look like for someone who is signed up in a selfless field? So us like therapists.
I think, especially for myself, it was about doing the work. I think part of being able to navigate being selfless is first to take on whatever baggage or thoughts or feelings or biases that you may carry as a therapist, and really looking inward to find that awareness.
I'm glad, you know what? I'm glad you said navigating you first.
Yeah.
Even though you're operating in a selfless space. Yeah. Because when you don't, like you said, when you don't understand your biases, and when you don't understand, who you are and what you need, it's really hard to continue to operate in a selfless space, right? Like if I have a bias and I'm working with a client, countertransference is real. Yeah. So if I'm not cognizant of like how this is impacting me because of a bias that I have, or how it's impacting my ability to really help my client, it's hard because now my mental health is impacted, or now I'm not able to show up like I need to as an unbiased clinician because I don't know my baseline when it comes to the things. Mm-hmm. But I do think self first, even though we're working a selfless industry, for sure, is going to be very, very important.
Yeah. I leave work at work. I don't discuss work outside of workspaces. I make sure, like I said prior, I do my own therapy work. And I just reaffirm and reassure myself that I'm there to guide. I'm not there necessarily to fix an issue. I'm just a part of this person's process in their own journey.
Yes. I think when new clinicians start out, like interns or associates, when they typically start out, depending on, like if you're an associate and you had a quality site, you might not feel this way, but you don't have people coaching you, telling you like, hey, don't necessarily work harder than your client. Like you might hear it if you have a great supervisor, but you're not hearing, listen, if that client don't want to do the work, don't do it for them. Yeah. Or if you're talking more, or if you're just constantly operating in solution focus every single time you work with a client, the client's not really doing the work. And now you're taking that work home, that mental capacity home, or you no longer have the mental capacity to go home with and use with, the space that you're supposed to leave for yourself, for your family. So
yeah, because I did have an experience like that in an internship where it was a client where I was like immersed in it. Like, is this person okay? When we're in between sessions, and I had to come to the realization, like, I can't care more than this person does. Mm-hmm. And the line has to draw somewhere.
Yeah.
Yeah.
Got to draw the line and stand on it. That's my favorite line.
Yeah.
Okay, so let's talk about code of ethics and how we've seen clinicians get in trouble for not practicing self-care. So what do you know to be true about the code of ethics? You know, ethics is my jam, but what do you know to be true?
I think the part that stood out to me the most when studying ethics is do no harm. I feel like I live by that to make sure that at the end of the day, even if you don't have some of the tools necessary, you don't further harm this person or put them in a compromising position. So I think with a lot of therapists, the code of ethics and then the issues with the clients is because of like burnout, and burnout leads to impairment. So now when you're impaired and you're coming to work, you may not be setting boundaries as good as you need to, or you may be blurring the lines of personal and professional. And so you can develop a relationship with the client that isn't helpful for them, and it definitely isn't helpful for you as a professional. So I think the code of ethics is do no harm. Make sure that if you are feeling that burnout or any feelings of impairment, you reach out to someone to kind of help you navigate that. Yeah. Instead of just blindly going in and now you have a situation with a client you can't get out of. Yeah.
And you know, when you're going through your internship program, or when you're going through studies, whether it's an internship, whether it's an associate, whatever, not all supervisors are the same. Not all practicum supervisors are the same. Not all professors are the same that are over those classes where they go into ethics, or that's over like the practicum classes. Mm-hmm. And I brought that up because, again, a lot of people don't know that it's literally written in stone in our code of ethics that you need to practice self-care. Yeah. That's in the Texas Professional Counselors Code of Ethics. That is in the American Counseling Association. Like, if you pull up the Code of Ethics, it is written in stone. And I want to say it's like usually one of the very last Code of Ethics in the Code of Ethics. But it's there. Yeah. And if you operate within certain environments, people bypass these self-care code of ethics because of meeting quotas, or because, you know, whatever the situation is for a clinician in whatever the environment is, they bypass it. And like you said, the first thing when it comes to us is do no harm. Yeah. So if I'm burned out, I'm more inclined to hurt people. Like you said, hurt people. Yeah. And I heard you mention something earlier about like, I try not to harm, or I try to make sure that I'm not harming my clients. But it's very, very important that we as clinicians have to remember there are going to be some clients that are not going to perceive their experience as non-harmful. Yeah. Depending on your approach, right? Like if you're a stronger clinician and you're like, you know, you like, okay, but I'm not going to let you go past that. That client may see that as harmful. Yes. And so just kind of, you know, I want to make sure people understand that like, not every experience you have with a therapist is not going to feel harmful. And I don't mean like the clinician is there like, oh, I'm going to hurt your feelings today. Not like that. Yeah. But like harm is in the eye of the beholder. So keep that in mind as a potential client. If you're listening to this portion of it, it's like there may be clinicians that are going to push you, and it may trigger you into your previous experiences with someone who applied pressure, so to speak. And so you just kind of got to keep that in mind. But our biggest thing is making sure that we do no harm. And like Aliyah mentioned, like if you are impaired, it's easy to possibly become harmful. Building relationships with our clients is 100% a part of our job. Yeah. But there's a fine line between an inappropriate relationship, a non-therapeutic relationship, or a dual relationship. Like clients are like, oh, well, I have this product. Can you buy it? And it's like, okay, well, let me read the code of ethics and make sure I understand that. But if you are operating in not practicing self-care, you're impaired. You're tired, you're fatigued, you're coming to work, and you're not even paying attention to what your client's saying. So you're like, yeah, I'll buy it. Not thinking about the code of ethics and what the code of ethics says and how that could potentially be harmful. Now, can you support your clients? Absolutely. But there is a fine line in the code of ethics that you have to follow and you have to document if you are doing things like that. So just keep that in mind. But it's in the code of ethics, and a lot of people do not know that. So if you have friends that are clinicians or in training, whatever, make sure that they understand that self-care is in the code of ethics. But also, if you're in your trainings, if your supervisors or whatever people in the field aren't teaching you that, and they're teaching you you're supposed to self-sacrifice and self-serve and be selfless in serving, just be mindful that's not healthy.
Yeah.
It's not healthy.
Yeah.
Okay. So how important are boundaries when it comes to shifting the dynamic from my job is to serve people and not self-sacrifice to do it?
I think it goes back to the point of I can't help you if I can't help myself. So we are in such a field that requires so much of us. I think we would be doing a disservice not only to ourselves but to our clients if we don't feel like we're coming in at least 80%. Because of course we're never going to have perfect days, but I look at it as I'm a good therapist if I'm also good to myself. So setting that boundary, like I said earlier, like I'm here to help guide you. I'm here to help bring awareness, but I'm not here to fix. Like my job isn't for me to come in here and just make all your problems go away, because that's a heavy expectation to carry.
Yeah.
So setting that boundary of like, this is my job as a clinician. I will help you in this manner. But like you said, the extra stuff, like, can I support this or can I do this that's outside of the therapeutic work? Putting your foot down on like, that's not something I may be comfortable doing.
Yeah. I think the hardest part for me, well, I've always had very strong boundaries since I was a kid. My cousin will tell you, my family will tell you that.
Yeah.
But one thing that I did struggle with when I pivoted into counseling is the environment that I worked in. I really, really had to lay into those. For example, with myself specifically.
Yeah.
Like I went from being a teacher to like, oh yeah, I'm gonna make sure my kids get home. Like I'm popping up at their job. Like you didn't come to school today, but you at work today. You know, I can't do that with my clients, right?
Yeah.
And so that auntie vibe that I thoroughly enjoy, I can't do that no more.
Yeah.
But then on the flip side of that, you know, when I pivoted into school counseling, it was still very much the same. I'm pulling up at your house. Yeah. I'm going to your granny house. Why you not at school today, right?
Yeah.
But I can't do that as a clinician, or I can't say, okay, here, let me get you some money for your light bill. Like I'm not a caseworker and I'm not a social worker.
Yeah.
And so when you're operating usually within the school counseling capacity, you serve in all of the roles. Like you're a counselor, you're a caseworker / social worker, you are a crisis worker, you are the 504 coordinator, you're the paper pusher, you're the person that calms down the teachers. You do every single thing on a campus. And you know, pivoting from that environment to private practice is very different, because it's like, oh, I don't got to do none of that. But I had to learn to make sure that I felt comfortable with not doing anything extra, because I served in a role where that was 80% of my job.
Yeah. You had all these different expectations.
Yeah.
Yeah.
And so it was like I operated it as everything. But I said all that to say is that setting a boundary with yourself is important, because if you've been conditioned throughout your programming or just throughout society where people are like, well, teachers are supposed to teach.
Yeah.
School counselors are supposed to do this. You're supposed to be self-serving. You're supposed to be compassionate. Yes, I am supposed to be all of those things, but I am not to be abused.
Yeah.
And so in order to prevent burnout, or in order to prevent feeling like I am not appreciated in whatever the industry is, I have to set a boundary with myself.
For sure.
So that comes first. I feel like boundaries with yourself comes first before anything, because you can't set boundaries with other people if you don't know what it feels like to set a boundary with yourself.
Yeah.
So when clients are like, oh, well, I missed this week appointment, I missed next week appointment, I missed the appointment after that. Okay, well, I didn't charge you a cancellation your first time. I let
this slide.
We talked about it. That was the thing. All right, the second time, all right, now I'm personal, right? Like I'm a person. So I'm gonna be like, okay, well, I have to set this boundary with myself, because when you're operating in private practice, it's like, if you don't show up, and I had somebody that really, 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 really wanted that spot, I ain't gonna say you're not taking it serious, but maybe your depression is so bad to where you literally can't get out of bed and you can't get here. It's like, I'm doing you a disservice now at this point if I continue to allow the behavior. Mm-hmm. So, or I gotta eat.
Yeah.
So it's like, I have to set a boundary with myself. Like, yeah, I care that you're depressed and you can't get out of bed, but we can switch to virtual. Yeah. Or we can switch to a different day this week, but I can't just let certain things go when it comes to some of those things. And so I think that that's the narrative that we have to teach in programming too. Like, we teach agency is where you're going to be at. We don't teach you still have to hold these skills of setting boundaries with yourself to be successful in wherever you go.
Wherever you land. Yeah.
And so it's like, you have to really, really learn boundaries so that you don't self-sacrifice and you don't self-sabotage by trying to, like you said, overly be here for somebody.
Yeah.
And operate within the role that is not ethical.
Yeah.
So, okay. So how can clinicians advocate for themselves within the workplace, within their marriages, as a parent, within their friendship dynamics, to really maintain their mental health?
Oh, I'm quick to tell them, like, if I'm not in the office, I'm not a therapist. Because in my personal life, I hear so much of, like, if I'm amongst family and friends, you're a therapist. I can't believe you said X, Y, and Z. And it's like, that's not my entire identity. Like, I set forth that I am a human above all of these things. So even with clients, like, if I miss something, I put it out there. Like, if I miss something, I have an open door policy. If you felt like something was said in a session you don't agree with, open door policy, bring that to my attention. And even back to personal, like, I'm no one's therapist in this room. Like, this is my personal life where I get to relax and, just be myself and say things that I'm not going to say at work because I'm a professional. So just, again, setting those boundaries of, like, when I'm at work, I'm dedicated to this. If I slip up or make an error, I'm here to correct that. Also give me grace because I'm a person as well as the client. And even with family, like, I'm a person. I'm not at work.
I'm human first and therapist second.
Yeah. So that's my mantra.
And I'm not your therapist. It's so funny because, like, people from, like, high school, or even just people you meet in the community, like, you kind of build these relationships, or you already have pre-existing relationships, depending on when you met them throughout your lifelong journey. And people will say things like, oh, I want you to be my therapist. And I'm like, no, ma'am. No, sir. I cannot. But I trust you, and, like, I can talk to you, and da-da-da-da-da. And it's like, listen, first things first, I'm human first, therapist second. So I know you, and I have a pre-existing emotional connection to you.
Yes.
Then secondly, firstly, code of ethics, right? That's second.
This is unethical.
And then it's like, I just can't. Yeah. Because if I'm a therapist to everybody in my life, when do I get to show up and be me?
Exactly. No, that's perfect. And even to your point of, like, can you be my therapist? No. Mm-mm. Like you said, one, it's unethical. Two, where is my soft space to land? I might want to come and say, of course, not sharing any client information, and say, I had a terrible week. Like, it was intense. And it's just like, no.
Yeah. And I think a huge part of advocacy too is educating your family and friends on what it feels like to be a therapist.
For sure.
Because people be like, oh, you just have an easy job. I love my job. Don't get me wrong. And most of my days are relatively easy. One, because I'm in private practice.
I have a note about that as well.
And two, because I just love what I do. So my days are not typically hard because I wake up and I'm excited to go and see my clients. Some of my clients are like, where you been at?
Yeah.
But for the most part, in advocating for yourself, you have to teach them, like, there are some weeks where I'm getting cussed out.
Yeah.
Like, no, it was not directed at me.
Yeah.
Right? I might be dealing with a client or working with a client who has a personality disorder or who has multiple personality disorder or bipolar disorder. Like, I might be dealing with or working with. Dealing has a negative connotation to me, because it's like, you over there dealing with that man. It's usually like a negative connotation. So I gotta make sure not to. But when I'm working with, like, sometimes you don't know who you're gonna get when you walk in the door. I could have been working with a client for 6 months to 2 years.
Yeah.
And it's gonna be one day, I'm just the person at the other end, and I'm gonna get cussed out for that day.
Yeah.
And I'm gonna be told, you hurt me 3 sessions ago.
Yeah.
When you challenged me on that, or I interpreted this way, right? My intention is not to do harm.
Yeah.
But I'm glad you brought that to me, and I'm sorry, that really hurt my feelings that I hurt you.
Yeah.
And so when we have mishaps, ones that are not as big enough to go to the board, but where you establish a relationship with a client, those things hit home.
For sure. They don't, and when I say they, I say in my personal life, they think like, oh, you're just talking to people. And it's just like, no, just as to your point, we can have emergency situations where, like you said, we're either getting cursed out, or we can have more extreme where it's like, I had to make sure this person stayed alive.
I remember there was a period. I'm glad you brought that up, and it's not funny because I was so anxious for like 3 weeks straight.
Yeah.
When we, like you said, we're in private practice, and we do have clients that sometimes do need a higher level of care, such as inpatient or just a higher or further evaluation. Mm-hmm. And there was a period where I just had like all of my I think most of them were long-term clients.
Yeah.
It was like outcry after outcry, and I'm like, now wait a minute now.
Yeah.
It's like 6 of y'all right now. I'm nervous.
Yeah.
And, there's no plan. There's no intent. I don't think you're going to do it.
Yeah.
But also, it's like 6 of y'all right now. And according to my code of ethics, my job is to treat, support, and get you the help that you need and, deserve. But I also have a trust that I have to maintain.
Yeah.
And so when y'all coming in, don't be scaring me like that.
Yeah, I'm with you.
Because listen, I actually do gotta call them people on you.
Yeah.
And I know for a fact that is gonna be traumatizing if you've never been through it before.
Yes.
I've worked in inpatient. I know what happened. I know what it feels like, or I don't know what it feels like per se directly, but
yeah,
I know what it looks like for someone to really go get help at a hospital. Like, I couldn't get in with my therapist. I couldn't get with nobody on the phone. And I just need another assessment and maybe some medication. That's what I need. I know that's what I need. I'm not going to do it, but I also know this is what I need right now.
Yeah.
And it's like, if I call and be like, hey, like, we can't get them anywhere, and I now have to recommend you to like a facility that could possibly inpatient you.
Yeah.
It's like, okay, you need the help, and I'm nervous. Because I know if I make that call, you might call me and come run me over in the parking lot. Because now you done experienced something traumatizing. But at the same time, my job is to protect you from you.
Yeah.
When it gets to that point. But I don't think people really realize, like, okay, yeah, we're an outpatient. But we might have gotten a client that just overdosed 2 weeks ago, and now they're back. And my job is to treat the substance use. But what if they OD? And now they're investigating it. And now I'm a part of it because they came to me for substance use.
Yeah. Like where, yeah.
Like, or if I got a client that came to the office and they're using substances in the bathroom, there's like, I don't think people understand how traumatizing our jobs can be, or just how much we can take it home. Even like working with people that have been sexually assaulted or abused or molested.
Yeah.
We get the kids or the adults of who went through that. Or sometimes we get the kids, and it's like, sometimes they want to share that story.
Yeah.
I can't tell you, no, don't share that story.
Because I'm not prepared for it. I don't have that
This
option.
Is a safe space.
Yeah.
Now, of course, we do have options, but it's like, do I shut you down?
Yeah. And damage what we are building? Or do I just like...
Because now I could be being harmful to you. Anyway, I'm going to stop going down that rabbit hole. But I brought that up because I think it's important for us to educate people on how difficult it can be. Yeah. And it's not roses and flowers. Like, it's just not
These
that
are
every day.
people's lives.
It's people's lives. Like, every time my clients come back to therapy and they be like, I heard your voice in my head, or yeah, I thought about what you said, or I told my friend what you said, and I'd be like, now wait a minute, what did I say? Like, was that me being, did I tell you me taking my therapist hat off and I said that, or was this like my therapist hat was still on? Like, I'd be so nervous sometimes, like, because I'd be like, sometimes I just be talking.
What version did
you get? What did you tell them people? I remember I had a client telling people, oh, my therapist will cuss you. I'd be like, don't be telling nobody that. Don't be telling nobody that.
But it's beauty in being able to show your personality.
Show up as a person.
Yeah. I think they appreciate it more and they're like, she's authentic. Like,
absolutely.
Yeah.
Yeah. So teaching your family that there can be hard days is important for advocating for yourself. Setting the boundary with letting them know, like, hey, I can't be a therapist 100% of the time.
No.
And then the other part of advocacy, I think, is vocalizing to the people around you when you need a break. Especially like if you're the more stable, level-headed, or just the more responsible person in the family, because not all therapists are created equal. I'm gonna just put that out there. Yeah. But if you are that person in your family and you're the therapist on top of that, yeah, sometimes you got to tell people, like, I'm taking a break. Yeah. I am healthy. I am safe. Yeah. I feel loved. I love you. But I can't hold that for you today or tomorrow or next week or the week after or for the next 4 months.
I love that you said that, because that was something my therapist taught me early on, especially when I first started in the field clinical hours, of like, you're juggling your personal life and then you're also dealing with the first experience of doing therapy and saying, like, I don't have space for this in my personal life. I have to focus on what I have going on right now.
Listen, it'd be hard. It'd be so hard because sometimes, you know, if you're like you said, if you're the responsible person and the therapist,
it doesn't stop.
It does not stop. It doesn't matter. It doesn't matter what environment you are. You could be on vacation and everybody know you on. I got a question. Or even in social settings, right? Like you go places, going to the kickback, and people are like, oh, you know how people do. Oh, I'm such and such. I've been here. Oh, what do you do for a living? What do you do for a living? I work in education.
I'm so glad you said this, because I went to the nail shop like a month ago, and the what do you do for a living came up, and I'm like, okay, this is my first time at the nail shop. I took a break. I go thinking I'm just gonna unplug for an hour, slipped up and said, oh, I'm a therapist.
6 people. Oh, she a therapist. Oh, what you think about this? What? Baby, I'm off the clock.
And I told my mom, I'm gonna start saying I'm an accountant or I work in finance or something.
Yeah, I work in education. That's it.
And she's like, Aliyah, and I'm like, what I just heard was insane, and I'm just getting a pedicure. Yeah. Yeah. So. Yeah,
there are no boundaries when people learn what your title is or what you do for a living, because of course it's in you. Like sometimes it's hard for me to not show up as a therapist unintentionally. Yeah. Like I'm not trying to, but like it, I lower my voice. I get talking really, really smooth, and I'm like, listen, friend. Like it just make you feel. And I be like, Asha, chill. No. All right. So do you believe that the environment in which a clinician works plays a role in the level of success in the number of clinicians practicing self-care within the organization?
Absolutely. Because going back to what we talked about being in private practice, I work for 2 private practices. So I have had the luxury experience of not being in an inpatient setting where it is more high paced and you're dealing with clients that are on the more severe end of things. So when I go to seminars or trainings and I speak with people who are in the inpatient or a hospital setting, and they're explaining I don't know how I'm making it. I don't know how I made it last week. And then hearing like their stories compared to what I've experienced of having, like, I have a pretty lax experience where I still can take care of myself. I have days to myself where I can practice my self-care. I have days where I can unplug versus they're still taking work with them home because they have to process a traumatic event that happened, or it's still a bunch of paperwork involved in something that happened. So I think the structure of a lot of environments does not create that for a lot of people.
Being a school counselor, first of all, I came from Dallas, so boundaries is like innate for a lot of us in the city, just because it's urban. So when you're in bigger cities, you learn boundaries. When you're in smaller towns, you learn like, oh, that's your neighbor, and like you should wave and you should go. We learn like boundaries early on, and so when you operating in school counseling, like I said, I had 1,000 hats, but I had boundaries with the kids. I had boundaries with the teachers, with the administrative staff, with the central staff, and I made sure to do my job to fidelity. And I also made sure that I left on time. And if it happened at work, it stayed at work.
Yeah.
But on the flip side of that, I'm able to operate at a high level very efficiently for a consistent amount of time, right? Not everybody is that way because some people are carrying things, right?
For sure.
Me, I can operate like that for a long time.
Yeah.
But if I did not have those strengths, those strengths or those innate responses to boundaries, I probably would be going home crying every day like some of my counterparts did, or angry every day, or upset every day. Yeah. I think when I did struggle as a school counselor, it was like conflict between a colleague, not necessarily, and it wasn't me having conflict with them. It was, them. And maybe one day I'll be bold enough to share that story. That was a whole thing. But anyway, that environment is different. And then when I worked in inpatient, I did work in inpatient, but I only ran groups. So the clients that were like self-harming or trying to attempt while in inpatient, I didn't necessarily have to engage with that because my role was group. So if you're in group and you start to experience a crisis, which I don't think I ever had that happen, then my job is to get the crisis, the psychiatrist, the nurse practitioner, or the aides that come in and make sure that they're safe. Or I put them on a Q15, which is a quarterly check-in, quarterly 15 minutes, where they have somebody that come check on them every 15 minutes. Or they're on a 1-to-1, 24 hours around the clock. Yeah. So I didn't have to deal with or to work with or engage with some of the things that some of my colleagues did because everybody has a role and everybody operated within that. But the organization that I worked with when I did do inpatient, they were very, very big on making sure that we were taken care of. So even though it was inpatient, I had a great experience. Yeah. Now, some of the other employees in different types of roles may not have felt that way. But my role as a clinician, I was good. Private practice has been golden.
I agree.
Setting your own schedule, making sure that you have the capacity. If you can't show up, you don't feel guilty about it. And there's nobody telling you, oh, well, you need to be at work today and tomorrow and the next day, or, we're going to fire your jobs on the line. It's not like that. Yeah. So yeah, I think the work environment does play a role, but most people who work in agency settings are burned out and they're overworked and underpaid because a lot of it is grant funding. So there's no additional income coming in. So when you see agencies, you probably see a lot of clinicians that don't practice self-care, not because they don't want to, but because maybe financially they can't afford to because, however the pay structure is wherever they are, or it's a situation where it's high needs all the time and around the clock. And not only are they operating as clinicians, they may be operating as social workers. Yeah. And then on the flip side of that, schools, it's easy to get burned out, especially if you don't have the central counseling staff and leaders supporting you on your campus, helping you negotiate your roles and responsibilities and being a part of your backbone, then it's hard to get like that. Yeah, if people are like, oh, that's what you're supposed to do as a school counselor. Actually, no. According to ASCA, this is my job, not that. So yeah, I think environment definitely plays 100% into the number of clinicians practicing self-care. Most clinicians in private practice self-care. Why? Because they can. Like, if I don't want to work on a Thursday because I want to go get a massage on a Thursday morning every week, I get to do that. Yeah. I get to do that. Yeah. So okay, last question. What do you do to increase or maintain your mental health when it feels like things are getting out of hand?
On the religious front, I pray. I go to church. I do lean on my personal and my professional support system. Just as we discussed, like, the support system within the job is important. And I feel like at both practices, I have that support of, like, if I'm feeling like I'm not comfortable to take this on or I can't handle this, I can get that additional support. So I feel confident in I can go to work, show up, and if something were to go wrong or something wasn't going right, I could reach out and get that help. Also leaning on family and friends on the personal side of, like, I don't want to talk about work. Let's go do something fun. Let's do something that doesn't involve therapy. So spending that intentional time away from work or away from the issue and then dealing with the issue in therapy. So I'm big on going to therapy. Yeah, absolutely. I will go to a therapy session and hash it out with my therapist. So, yeah.
You know, it's so hard when you live in a city where the Black population is so small, trying to find a therapist, quote unquote, that don't know you.
Oh yeah, my therapist lives in a whole different city.
Well, I brought this up because there's a lot of clinicians that do want to get help that are people of color, specifically here in Austin. Yeah. And it's so hard because if you know one Black therapist, you know them all. Yeah. And so, you know, it's kind of hard to practice that depending on where you are receiving your supports at. But absolutely, definitely. For me, yeah, I shed. Phone goes on Do Not Disturb. Everybody understands that I'm taking a break right now. No social media. I make sure that I focus and pour into myself. Yeah. That's how I maintain when things get tough. And of course, mental health professionals. I like physical healing too. Like, massages are like my thing. Yeah. So if I feel like extremely anxious or overwhelmed, I try to make sure I be like, listen, can y'all get me in? Because I need that right now. Yeah. So, okay, well, good. Thanks for sharing for today. I appreciate you. And I hope that future clinicians or just clinicians now that's been in the field for a while that has still struggled with it have been able to, will be able to take something from the video. But thank you guys for watching. And thank you so much, Aliyah, for being here today. And we will see y'all in the next episode.